Recording. All right, so this is being recorded, guys. Today is May 29th, 2019. It's 12:10, and we're just getting the webinar started. Just for people that are going to join in other future webinars, be aware that we'll give you a 10-minute time frame to get into the webinars. I do start the webinar about 15 minutes prior to noon or whenever the time will start, so that you can jump in, kind of ask your Q&As up front, do an interactive with everyone talking to each other, and then mute the webinar so that I can just do the presentation for the next, I would say about half an hour is my goal, to kind of keep you guys interested. Sometimes I know going longer, sometimes people get turned off or just kind of fade out, not really paying attention. So anyway, I'm Neil Schloss. I am the one who kind of put this whole website together, program together, compensation model. I'm a CPA with 25 years of experience as a CPA, helped many businesses grow, automating and using technology to make life very simple for people. And ultimately, the goal was to build a program that was very simple, easy, efficient, and I mean, to some extent, so simple it's hard to understand. Because like you who are on the call mostly know, it's very simple. See a doctor, get the recommendation, submit the recommendation to us, and then order your medicine and have it shipped right to your house. So with that, there are ground rules. Like I said, if you do have questions that pop up in your head as you go along, you can hit the Q&A and post the question to me. Most likely I will cover it throughout this presentation. So as I say, I'll answer questions even that are popping through your heads, and at the end, hopefully there won't be many questions because I've answered them all. Invite your friends and family to these webinars. Most important is for them to understand how this program works, to see how easy it is to help someone get medical cannabis into their lives, as well as learn how to use cannabis correctly. Along with that, we do try to speak the correct language of the Compassionate Care Act. We do refer to, as people say, marijuana, pot, weed, as just medical cannabis. I basically got to a problem where I'm correcting everyone on when they would use those terms. I would just say it's cannabis. There are also other words that we will use throughout the presentation. So if you notice them, just try to incorporate that into your vocabulary and get away from the old language, because we want to make sure that people understand this is a very serious topic about helping people and understanding what medical cannabis can do for you. With that, we will go through navigation of the site, show you behind the scenes so you can see how the administrative team processes people that are joining, how it's assigned to the affiliate that was selected, go into the compensation model, and then just close up with the Q&A. Along with that, I'll try to show you some websites that give you some information for education, so you can really understand the cannabinoid profiles, the different types of cannabis compounds that are in the medicine. So with that, I'm going to switch over to the website. I'll close the tab over here and start with, of course, most importantly, and let me hold on one second. Let me make sure I'm sharing the right screen. Let me share that. Okay, so you guys should see the homepage of CannaSense. CannaSense, of course, was derived under about 10 years worth of research on a program to put together to help people guide you through the medical cannabis program, called the Compassionate Use Act of 1996. In 2005, a client of mine came to my office to discuss a tour business, bringing patients out to California, bringing them to a doctor, see the doctor, go to a dispensary, pick out your medicine, and take the medicine home with you. Thought it was a great idea. At the same time, I thought it was a lot of questions of concerns, of fear, of how do you take medicine home from you, fly on a plane, which actually the TSA just recently released an announcement on how they're treating people taking their medicine with them on airplanes. So the timing is pretty perfect because, like I said, to me, I'm like, if you want your privacy, You want to get your medicine, you want to get healthy, it's very simple. If you can see a doctor virtually, order medicine and have it shipped directly to you. So in 2005, telemedicine was not part of the US vocabulary. Telemedicine became effective under the Affordable Health Care Act with Obama, where he allowed patients to see doctors virtually. So with that, of course, that launched the site in 2015, where we designed it so that hopefully it's really straightforward and easy to follow along. First page is just saying hello. Of course, there's a foundation that CannaSense created. It does cover these 6 areas, which at this point we're funding every month with 10% of the gross profit of the month. So that has been growing, and of course, as that account becomes pretty solid with money, we'll start putting the foundation in place with doing all these different areas. With that, when you click on Learn More, it does take you from the home page over to Education. So you're just moving to the 3rd tab over, where it talks about what is CannaSense. It is what's called a nonprofit mutual benefit corporation, established under the Compassionate Use Act of 1996, where of course we allow patients from all 50 states, as long as they have a valid recommendation, to join and get medicine shipped to them. It's a very simple process. How is it legal? Of course, it became legal under the Compassionate Use Act of 1996, along with the Affordable Health Care Act, and most importantly, the Constitution. We're under Article 4, Section 1, which is right here. It states that that full faith and credit shall be given in each state to the public act records of every other state. So since the Compassionate Use Act was an act done in California, all other states should recognize it under the Constitution. Going down, we talk about the cost to join. Very simply, there is no cost to join. If you just want to be a caregiver and help someone, you can join with your information, get assigned an affiliate number, and then just help others. And if you just want to be a patient in a program, once you have your doctor's recommendation, you submit it, and of course, with that, join the collective, and you can order your medicine through the collective without actually having an outlay upfront costs. We do talk about an upgrade from a patient, which is to become a member. The member is very simply, you buy a welcome kit. That's the only thing that makes a patient a member, is a welcome kit purchase, which we made it a $420 purchase, which does include your medicine. And besides your medicine, part of the proceeds from the welcome kit is a compensation to the caregiver that helped you join, which would be a $100 commission paid to the caregiver or the sponsor or the affiliate, those 3 terms. Okay, there are different customizable welcome kits that we put together, and of course over time we'll add more as we see fit, and the suggestions come in through the tickets, ticketing system we have on our system. Caregivers, or that term caregiver in the Compassionate Care Act, allows for compensation to be paid out to caregivers. So that's why the caregivers become the affiliates and the sponsors, and of course they're eligible to be compensated. Caregivers and only caregivers that are not members or non-patient members are eligible for the $100 bonus on the $420 welcome kit purchase. The only way to participate in the other parts of the compensation plan is to actually upgrade to a member or to a non-patient member. Talks about, is cannabis really medicine? What we've seen with people that have been part of the program, as well as studies that are done and research and information provided to us all now, that it really is being defined as medicine and helping us with the symptoms that overcome some of our ailments. My ailment was a back issue. I had sciatic nerve pain back in 2013, and of course cannabis definitely helped me at that time. With that, we do have videos if you want to learn more about what the cannabinoids are. If you do click on it, it does open up to another tab, just so you're aware not to be concerned about clicking onto the tab and not being able to come back to the page you were just on. You're able to look at how medical cannabis is tested, understanding a cannabinoid profile of what THC is, what THCA is, and of course what is CBD. Those are the videos we have on this site at this moment. With that, like I said, you can come back to the main tab, which if you're not sure of what ailments are treated under medical cannabis. You can take a look at the list, and you'll see that I did start to kind of hyperlink the medical conditions to other websites. So if you're not sure of what some of these are, you just click on each of the words and it'll open up to a website that has the definition, so that you can really start learning about these different medical conditions. At this point, you can see how long the list is. I did stop at a certain point, which my goal over the next month is to get this completed so that every single word ailment can be set to a website that educates you on that. And that's on what can it treat you. Besides that, there are hyperlinks to many other websites just for educational purposes. So we do suggest you click on those at your leisure, and of course learn more about cannabis so you are informed and you can help others. If you want to get into extensive information about medical cannabis, this hyperlink takes you to the next part of this tab, which is just information for using medical cannabis. We, of course, talk about what is cannabis, what's the endocannabinoid system. If you're not familiar with the endocannabinoid system, you can Google that and definitely watch a lot of videos on the endocannabinoid system within our body. And just a quick thing of the endocannabinoid system, that's an internal system within our body that actually produces cannabinoids that our body uses. And of course, once we have an ailment, the endocannabinoid system slows down to where those cannabinoids are not being produced, which is why introducing phytocannabinoids into our system, which is cannabis, as a plant-derived cannabinoid is introduced, and that kind of replaces the internal cannabinoids that our body is not producing. And again, you can click on all these to open these up to show you a little bit more about different areas of learning about cannabis. I do like to show people that this chart is an awesome chart that was provided to us through SC Labs, which was a laboratory that we use for testing our medicine, which very simply is going across the top are the chemical compounds within the flower. You have THC, CBD, CBG, and so forth. And on the left side column is the medical ailments that, if you were trying to help, tells you which cannabinoid you want to try to get in the plant so that you can have it go as a phytocannabinoid into your body. And of course, helping you with, example, weight loss, you'd want a THCV chemical compound so that you ultimately help reduce your weight if you were looking to do weight loss and so forth. So you can look at this chart again at your leisure. This is definitely a very cool chart to help you understand more about medical cannabis and how you can use it medically. Let me just bring the screen back to normal size. And with that, we move on to just becoming a member in the program. So let me just talk about this a little bit, which is, of course, there are 4 options in the program, but as far as joining, all 4 of these lead you to the same exact form. These are just more for information to understand that, like I said, a patient and a caregiver does not cost to be part of the program. But if you do want to upgrade to a member, all you do is buy the welcome kit for $420. It's a one-time purchase, lifetime membership into the collective. And if you're a caregiver that does not want medicine but wants to participate in the compensation plan, they can order the welcome kit. I think it's welcome kit number 8, which is the non-patient member welcome kit, which is a one-time $300 payment that converts you over to a non-patient member and then makes you eligible for the compensation plan so that you can earn compensation for patients that are purchasing medicine monthly. Okay, there's a little bit more information down below, but if you click on any of these buttons, it will take you to the sponsorship form, which most of you that are on this call are probably affiliates already. So you're very familiar with this form. And I'm going to just make sure that you're well aware that this field can be automatically populated if you are sending out a URL that references your sponsorship number. And I'm going to point that out once we go into the actual dashboard show you how you can set it up so that if you send out a hyperlink to a friend, that field is automatically populated. The problem we saw in the past was that this hyperlinked URL was getting thrown all over the internet, that people were clicking on someone else's hyperlink, having that field be filled in, and of course getting the call saying, hey, I sponsored Joe in, and Joe's not assigned to me, and we found out that they actually were sponsored to number 5 for this example. So what we did was we created a secondary field that is must be entered by the person joining. So of course, if it was a different information than in the field above it, we do say that this supersedes this field, so that it gives at least that person who is a sponsor or affiliate or caregiver the opportunity to make sure that their name is being correctly put in and getting the correct correspondence to them in the program. With that, they fill in the rest of the information. Today, we're going to put Daffy Duck into the program just so you can see how Daffy at CannaSense.com actually fills out the form. 833-633-4208. If you're not familiar with the 800 number that CannaSense has, that is the number to call in if you have any problems with orders, questions on being a sponsor, and there are people that will pick up the calls and help you out. As well as once you join and you have an affiliate number, and if you'd like to get your own extension, which would match up to your affiliate number, you can order that within the apothecary, and it is going to be assigned by Daniel Crumpton, who makes sure that it does match up to your affiliate number. The cost on that would be, if you want to do it on a monthly fee, is $4.20 monthly, or you can buy an annual subscription, an annual amount for $42, which gets you your extension for the year. Okay, we're going to fill in the rest of the information. We'll do one test drive in Test City, California, 11126. And then we create Daffy's Ducks username. And down here is where you will see that there's just a few options to choose. If you, by default, don't choose anything, the only thing that needs to be uploaded is your government issued ID, which is considering yourself as a caregiver, that you're over 18 and that you do agree to the terms. If you do choose patient and you're over 18 and you do agree to the terms, you'll see not only do you have to upload your government ID, but you do have to upload the recommendation at that time. We do validate that the recommendation is correct. If you are not, you don't have your recommendation at the time, we do tell people who are joining just to sign up as a caregiver, and then once they upload their missing document of the recommendation to us, they will automatically be upgraded to the patient status. So if you're trying to get someone to fill out the form, they can just fill it in as a caregiver, say yes to this, yes to the terms and conditions, which I do recommend everyone reads and understands, the membership agreement as well as the guidelines and standards. Have them sign up. Select the file. So right now we will pick a quick recommendation. It doesn't matter what I'm putting here for right now, but definitely make sure that you do have the person upload a valid government ID or a valid recommendation and or a valid recommendation, and then of course submit their information to us. Okay, which at this point, a few things happen behind the scenes. One is an email is sent to the person's email, which lets them activate themselves. Once they activate themselves, they are definitely set up as a valid caregiver, but the pending patient status is set up so that we can do the validation behind the scenes and make sure that a person who submitted the correct documentation as a patient is valid, and then we activate them from there. So at this point for joining, that's the steps necessary. Just to quickly go through the site, you got the home button, which we've shown you. The Become a Member section is the member agreement, guidelines, the standards, and becoming a member option. The education is the education, information, and video section that we had talked about. This About Us tells us the mission and vision of CannaSense Total Wellness. The perspectives page, as Daniel's doing, is adding radio shows that we've done, different web links to stuff that are being posted about CannaSense. And then the rest of this is simply if you want to sign into your account, we're going to get into in a second. If you want to, if you have a question or an issue with the program, you can submit a ticket, which we look at every day and respond. And if, like I said, you set yourself up as a caregiver, but then actually saw the doctor and got the recommendation, you can upload the missing document to us, which then we validate behind the scenes. All right, so with that, I'm going to sign into the account, and I'm going to sign in as a member. So if you give me 1 second, guys. Go to my account. Log into my account. This is where you'll sign in. So if you give me 1 second, I will be right back after I sign in. Let me reshare my screen now. All right, so what you see here is the dashboard of the website. This is what you first see when you sign into your own account. And if you give me 1 second, guys, I'm gonna unmute you for 1 second. Does anyone have any questions so far? And has everyone seen the correct screens I've been showing?
Yes.
Okay, fantastic. So you guys are, oh, didn't mean to do that. This screen is the one I want to share. All right, so you guys can see the dashboard, right? Where it says payment options.
Yes.
Okay, thank you.
Gotta work, huh?
All right.
E-checks.
All right, guys. So as far as the dashboard goes, this is just a simple attention telling you that we do accept e-checks all month at all times. Credit cards, we've been working on increasing our limit with the credit card company so that we can keep it on for the full month. But at this point, we are reaching our limits about mid-month, maybe till about halfway through the mid-month, 3/4 of the way through the month. So what we tell people is if you do want to place an order, make sure that you do a credit card order at the beginning of the month so that your order gets processed through without any issues using your credit card. The second section, which we just added, which is every week we will do new webinars, and I'll be updating the registration for it to the new registration form. Okay, you have your disclaimer on what this is about with the medicine, making sure that we tell you not to operate any heavy equipment while using the medication, and of course, be responsible about keeping out of the reach of children and pets. Just so you know, a client of mine is a veterinarian, and he has had animals come into his veterinary practice because they actually ate the medicine of a patient, not a patient within our program, but just people that have had cannabis lying around. So too much cannabis for a pet is a little bit dangerous. Definitely get them into a state where you'll be rushing your pet to the vet just to make sure that they're safe. And if you give me a second, I'm going to try to mute everyone again. So, all right. So now, as far as the dashboard goes, I'm going to point out things before we actually get into the apothecary. If you had placed an order within the apothecary, you can look at the list of orders you've placed from the beginning of time till now. Okay, and of course you can have the option of actually taking actions on them if the order has not been processed or completed. So we do get tickets submitted to us that someone says, I just placed an order, I need to be canceled. They can actually take it on their own efforts by just coming into their own dashboard, clicking on orders, and then taking the action to cancel the order. Okay, under my memberships, it tells you what you are within the program. In this case, you'll see that I am an active member. My start date was back in 2015, October 2015. For me, at this point, this is a non-applicable expiration because I use this for demonstration purposes only. But if you were to be an active patient, the expiration date should match up to the date of your expiration of your recommendation. So if you notice that the date is becoming close to being expired, just click on Renew Recommendation and then walk through the steps to go do your new recommendation. And then once you do your new recommendation, upload that recommendation to the Missing Documents folder, or click on this, upload the document to us, and the staff behind the scenes revalidates you and updates the expiration to the new date, and you will receive an email saying that that was completed. Besides that, under my memberships, if you were to want to download certain documents, we do have documents within the program, and hopefully in the future we'll be adding people that write books, their documents, their books that you could download their documents digitally. But this is where your downloads would be. The addresses is your ship to and build to address, so if you need to make changes, you can make that here. If you want to change your password, you can click on your account details. If you do want to submit a ticket, you can also do it within here. Because you're logged in, you can look at the tickets that you've actually submitted. And if you're done, you can log out of the site when you're done. The buttons here, like I said, the upload, the renewed recommendation are just used if you need to go see the doctor and upload any missing documents. Becoming a member button takes you to the apothecary straight to the welcome kit section, so that if you are a patient, you can switch to becoming a member just by clicking on that, pick the welcome kit out, purchase it, and once the welcome kit is completed, which means it arrived at your house, you made the payment, and the USPS has notified us that the order was delivered, the system will automatically upgrade you to a member, which does give you discounts on the medicine. The affiliate area is used for assigning you your affiliate number. So in this case, you can see that when I did the sponsorship form, I had chosen number 5 because that's who this account would be referenced to. As I had mentioned to you before, here's a URL that you can take, copy it, paste it into any social network to say, if you're interested in medical cannabis, give me a call. And of course, it references your number so that if they clicked on that link, it would put that number into that sponsorship form field number 1 up top. If you want to, you can create campaigns. So if we want to say this, we want to do a webinar 529 campaign, we can take that, generate a URL, and you can see that it generates it with my reference number to my affiliate number with just a campaign, so that I can keep track of campaigns that I want if you were into figuring out how well campaigns run for you. The statistics, graphs, and referrals are not really applicable in our program. They're there because they're just by default within the affiliate section, so don't worry about that. The payout tab is a tab that you can check out at the end of every month, on the 15th of the month following the prior month. So on May 15th, you should have a payout PDF of your account, of how you did, what you should have gotten paid, if you were not eligible, why you're not eligible. And then on the last page of the PDF would be the compensation model that is posted on each payout form. The visits and creatives are not really applicable as well. The other 2 are settings, just so that you can set your settings so that sub-affiliates are shown via list versus just the graphical sub-affiliate list. So you can see what your the people that have joined underneath you, if they're a caregiver, if they're a member, if they're a patient, or they're non-patient member. And they're color-coded just to kind of help guide you through that properly. So that's the affiliate section. That's what we encourage people to use. I mean, I jokingly say in the long run, people will have softball teams with the CannaSense shirts. And you can see on mine, I have a CannaSense t-shirt that on the back, in the long run, I put number 5 on. So people ask me, why am I number 5? And that's a good way to say you can call them a number, hit extension 5 to get me. You can say if you join, you can choose number 5 to choose my number. But again, number 5 is not applicable to anyone here. People that have brought friends and family, make sure that you tell them your sponsorship number. That's most important. This webinar is about just letting people that are joining sign up under their friends and family members so they can get the compensation for helping out. The apothecary is the area where you can order books and magazines, CBD flower, medical THC flower, donate to the charity if you wanted to, CBD capsules, clothing and accessories you can order, concentrates, edibles. The marketing material is where I talked about the Ring Central account, where you can order a Ring Central extension for the year. And you can also have customized business cards made, which are great to hand out, that I've handed out plenty, just so that people become more well aware of the program. In addition, for everyone that's listening, if you do place an order for flowers, in the flower order that comes, you should be receiving about 3 to 5 business cards that are by default a blank line under who the sponsor is, so that you can fill in your own sponsor number and use them as your own marketing material. Besides that, you have the welcome kits, and like I talked to you about that earlier, the welcome kits, there are 5 welcome kits that are for patients. Welcome kit 1 is 1 strain of 1 ounce. Welcome kit 4 is 4 1/4 ounces. Welcome kit 2 is 4 vape cartridges and a vape pen. Welcome kit 3 is a vape kit with a 1/2 ounce of flower. Welcome kit 5 is a CBD-based, CBD-only welcome kit. So people that do not want to have the THC effect, they're best to order a cannabidiol-only welcome kit. And welcome kit 8 is the non-patient member welcome kit. And besides the welcome kit, like I say, you got Natural Extract is a CBD company. We have nutrition products, tinctures, topicals. A new company we had just added, Lifted Lotus, is a nice product line to be used. You can order vape cartridges and, of course, vape pens. So, and as we go along, we will be adding more products to the site. And, of course, you'll see in Facebook, Daniel posts up any new products that get added, new flowers that are popping up. So we do have one question. What is the cost to renew? Catherine, there is no cost to renew within CannaSense. The cost to renew a license is depending upon the medical doctor you're seeing in the company. And I can unmute everyone to see if we can unmute all. Hey guys, does anyone know the costs they've seen for renewing their licenses recently? Anyone of you guys recently renew your license, your medical license? If no one's answered, Catherine, like I said, I've seen my guess is between $30 to about $80 for renewals on the medical license. But renewing within CannaSense, there's no cost. Once you upload your new recommendation, you're just reactivated. Does that answer your question, Catherine? I think Catherine is off the call right now. Anyway, anyone have any questions on the program? What we've gone over so far? Nope, you're good. Karen, Daniel, and Joe?
Yep.
Okay. Just some other things I want to point out is other websites I've gone to, which is, let me share this screen. Okay, so SC Labs, guys, is a great resource for information on what cannabinoid profiling is. This is the lab that does testing on medicine. A cool resource within here is, of course, understanding what each of the cannabinoids are. So if you click on the resource tab under SC Labs, slide down and go into your cannabinoids section. This is where you can understand what CBDA is, THCA is, CBD, and a few other of the cannabinoids within the plant. All right. Besides cannabinoids, cannabis also comes with terpenes in the plant, and terpenes are really the aroma or the bouquet of the plant, and you can get an understanding of what the actual primary terpenes that are found in cannabis. I'm trying to pronounce some of these. I probably will butcher them, but just again, these are just more great locations to learn about cannabis and the medical stuff behind it. Okay. So the last section is, let me get back into the site. Give me 1 second, guys. On your dashboard, if you haven't noticed, right below the apothecary is the compensation plan. I'm going to open that up in a second. All right, so we're in our dashboard. And like I said, down here under the CannaSense News, if you click on the CannaSense Total Wellness Caregiver Compensation Plan, if you go to the 4th page, and we're going to zoom in on this. Okay, keeping it as very simple as possible. Anyone that joins is considered a caregiver. And if they are a member or a non-patient member, and they in the month purchase $25 in their own account, then anyone below them under levels 1, 2, and 3, they would be eligible to receive 8% on the first level, 8% on the second level, and 7% on the third level of what's called the bonus volume, or the BV, of a product that's being purchased. So if you've seen the letters BV on a product that you've purchased, that means bonus volume, and that number is multiplied times this percent to come up with the amount of compensation for someone purchasing that item. To move up the chain, a regional caregiver would have the requirement of $150 ordered within their own account. That below them on the first level, that they have 3 people that are actual caregivers that have qualified themselves with their $25 purchase. And if they do have 3 people underneath them that have purchased the $25 and they've spent the $150, it will open up that the 4th level of their downline. You'd be eligible for 6% compensation on the bonus volume for those patients. Okay, and so forth and so on. So the simple goal is just get involved. And again, if you are a member or non-patient member, if you do see that you're eligible in that month, you can order your $25, and then you open up the compensation for the first 3 lines. For those that are unfamiliar with this, at any time during the month, so after this call, you can actually email commissions@cannasense.com with the subject matter saying reports or report, and within 15 minutes, a report is sent back to you of the mid-month report showing what activities has happened so far with your downline, and if it would be wise to order and qualify yourself within that month. Does anyone have questions on that area? Hearing none, I'm gonna close this, and of course just open it up to the floor right now. If you give me 1 second, let me stop the recording.